We'll get straight to sort of headlines, I suppose. There have been a number of events over the weekend, including some clinical issues, which Dr. Brink will talk about, some changed arrangements at the Princess Elizabeth Hospital, which Heidi will talk about, and also a decision by the Policy and Resources Committee in relation to pay settlements across the public service as well, as we clear the decks in preparing for the next few weeks and months. But I'm going to begin with an open letter which I've drafted to the bailiwick, recognising that actually my role as the chair of the Civil Contingencies Authority in overseeing this emergency is for the entire bailiwick, not just as an elected politician for Guernsey. And I'm sure that the last 10 days have probably been the most extraordinary in all our lives, with the possible exception of those who lived through the occupation. We've all clearly had to adapt to a great speed to the loss of personal rights, which would have been inconceivable only 2 weeks ago, imposing mandatory self-isolation if you arrive from outside the bailiwick, and granting the government the powers to deal with anyone who does not comply. Businesses have been closed, a great personal loss, of course, to many, and sadly, some of those may not reopen. And we're just at the beginning. The whole community is anxious, fearful even, and that's completely understandable. And I absolutely regard it as part of my job to help calm nerves. We all have people we love, whom we are worried about, and sadly, before this pandemic has run its course, we will all know somebody who has been touched by grief. So it's to be expected that some islanders will have been spooked by the apparent rapid increase in the number of positive test results in the last few days, and I want to explain to you what the strategy is, why the number of positives has increased, why those results are actually good news, and where we go from here. Firstly, let me remind you of our strategy to manage COVID-19. We cannot permanently disconnect from the outside world. This is a global pandemic, and there is no prospect of keeping it out of the islands. So the objective is to contain the disease so that we can manage the caseload through our healthcare system. And this is sometimes referred to as flattening the curve, which really means spreading the course of the disease out and lowering the number of people who have it at any given time. This strategy requires an ability to process a large number of tests quickly. And for this reason, weeks ago, we ordered the equipment that enables us to test on island. We are very nearly in a position to start that local testing, but not quite yet, as we wait for the final piece of kit to arrive, we hope very soon, from Australia. In the meantime, we are reliant on the UK's testing resources, which are self-evidently under considerable pressure at the moment. This gap, before we have our own facility, is a vulnerability, which we are managing by greater controls than the number of positive cases justifies. In other words, we are being very prudent and conservative. Secondly, the number of positives has rapidly increased for one reason only. The testing centre we were using in the UK became overwhelmed, which introduced significant delays to tests being processed and even threatened them continuing. For a few days we had no new information, and we were in a sense flying blind, so we decided to tighten our controls even further and earlier than others around us by, for example, introducing mandatory self-isolation for those travelling to the bailiwick. Deputy Soulsby and I made extremely robust representations at ministerial level to the UK government regarding this situation, and thankfully a new testing centre was identified for the bailiwick to use, which has been working very well for us since. Thirdly, we all need to learn to interpret the positives. The ones reported since Friday contain, in fact, very good news. Why? Because none of the cases provide any evidence of community transmission or seeding. In other words, all the cases involve those who have returned from travel outside the island. Or also, the positives prove that the system works because of the earlier decisions to extend testing to detect those at higher risk of acquiring the infection. These cases were identified following a local analysis conducted by Dr. Brink and her team of the global situation on the 15th of March, which resulted in a broadening of our requirements for returning travellers to self-isolate on the 16th of March. The 19 new cases were identified as a result of that enhanced self-isolation requirement introduced locally to detect imported cases. Contact tracing of the 19 cases was initiated over the weekend, and the next 7 days will be crucial as we try and ascertain if there's been any onward transmission. Results from patients with respiratory symptoms who are inpatients at the PH, who are all tested, irrespective of their travel history, are all negative to date. This means that from the evidence we have, it indicates that we still remain in the contained phase of our plan, which is to isolate cases, undertake contact tracing, and quarantine the close contacts. Finally, where do we go from here? The next few days are particularly crucial. Although community transmission is inevitable, it is the rate of community transmission that will dictate the measures we need to take. If we get evidence of community seeding before we have our full testing program up and running, for example, if we detect a case of the virus in a hospital patient who has not recently travelled and has not been in contact with another known case, we will almost certainly need to tighten further controls on the community. Now, the public are on a spectrum of opinion. At one end, there are those who wanted the island shut down on the 1st of January, only allowing out those in full hazmat suits until a vaccine is produced in 18 months' time. At the other end, there are still those who think that this is an overreaction to a bad case of the flu. Neither group is right, although as the small number in the latter group ignore public health advice, the former group are more likely to get their way, and I will return to that a little bit later. We've all seen full lockdowns in a number of countries, including France, Spain, and Italy. As people see this happening elsewhere, of course, a number have inevitably taken to social media, email, and phone to demand that we do the same in Guernsey, and that we do it now, particularly following the increase in the number of reported positives in the last 48 hours or so. And let me explain why that is not the right step, at least not at the moment. If we did so, we have absolutely no idea how long it'll be for. A couple of weeks would probably be fine, but we cannot hope to shut down our entire community for, say, the next 3 months. And it could easily be that long, given that we're only at the beginning of this. Seeking to self-isolate the entire community for that period would present a huge enforcement issue with limited resources. Unlike other jurisdictions, we don't have any troops to deploy on the streets to keep people in their homes under curfew. It will also present a real challenge to the mental health and welfare of the entire community. We have already understandably seen an increase in mental health issues in the last few weeks. I dread our first COVID-19 related death, which I know will happen. But right now, I fear that the risk is far greater that will actually come from somebody taking their own life. Perversely, social distancing risks substantial social isolation and all that follows in terms of increased alcohol and drug dependency, depression and anxiety, resulting in more suicide, self-harming, domestic violence and divorce. Social isolation will damage us all and potentially create a longer-term social problem to add to our more immediate public health and economic problems. In other words, the population would literally go stir crazy. And the longer we're in lockdown, the more permanent damage will be done to our economic base, creating further mental health and social problems, as well as making our recovery in due course that much harder and slower. Let me be very clear. We may still need to lock down, and we might need to do it soon. But we are not going to do it just because today's popular opinion says we should. Now really is the time to listen to our own on-island experts who have done such a good job so far and not take the easy option of pandering to a few armchair opinions. Neither will we do so just because other countries deem it necessary for managing their stage of the disease. We will do it, and we will have no hesitation in doing it very quickly, if and when the evidence of infection in our local community shows that it is the right thing to do. There are some of you who think that none of the restrictions apply to you, the group who think that it's just a bad case of the flu. You are ignoring advice in relation to social distancing. We've witnessed some of that poor and selfish behaviour at the weekend. Consequently, the majority can be reassured that we are actively reviewing what further steps we need to take to ensure you do comply in the wider interests of the community, and further steps may be announced later this week. We know that economic well-being is integral to health and community well-being. The bailiwick, like everywhere else, is facing an economic shock. We're going to do all we can to support our bailiwick's employers, their employees and their families. A first set of support measures was announced last week. Further measures will follow. It's not going to be easy for many of our businesses, but we will not forget that we are all in this together, and now is the time to support each other. In the meantime, I have this advice for you. Until it changes again, our new normal life goes on. All economic and social life does not need to stop. If you can, get out, enjoy the spring, and get some air. It is okay to smile, laugh, and play. Be kind to yourself as much as to others. I know you will, but support each other. Ignore rumours, ignore the Facebook and Twitter experts, ignore what is happening outside the bailiwick. Trust gov.gg as your source of facts. Trust our experts in public health, and trust us. We've got this. Don't panic, keep calm, stay strong, wash your hands, and observe good social distancing. As we prepare to head into this dark, scary tunnel, it may be hard to believe right now, but I promise you that we will get through this together. We are one step ahead, and we intend to stay one step ahead. Many more people than you will ever know are working every waking hour to do everything we can to protect you and your family. I promise you that we will not compromise and risk that objective, not least because we have skin in the game. We want to protect our own families too. We will continue to act quickly. I promise you that we will keep you informed of what we are doing and why. I will level with you and I will tell it to you straight, good news or bad. I promise those of you in Alderney and Sark that you can be reassured that you are every much a part of our planning as Guernsey. In return, I ask that you make just one promise, that you will seek out, understand, and then diligently follow local public health advice. Thank you very much. That's from me, and then I'll pass over to Heidi.
Thanks, Gavin. I think it's important that I reiterate some of the points that Gavin's made, particularly around the cases, and then I'll talk about what we're doing at the hospital and elsewhere. At our last press conference on Friday, we advised that we had an additional positive case, and since then the number of positives have risen to 20. And I can understand why people may feel anxious about this, and very many people have been. A tenfold increase in just 2 days. But really this needs to be looked at in context. Firstly, the good news is we're picking up cases because of the advice provided by the Director of Public Health. It is because of her advice that we moved high-risk areas into Group A early on, and then the rest of the world this time last week. Had we not done so, we would not have been able to pick those cases up, and we would have had considerable community seeding a fortnight ago. This approach has been more cautious than any of our nearest neighbours, and to date, unlike our nearest neighbours, there is no evidence of community seeding taking place. We also need to understand that the increase isn't due to lots of individual cases, but clusters. So we have 10 cases linked to 4 clusters, and these have been picked up by public health, and contact tracing has been undertaken from the moment they were identified on Friday throughout the weekend. And on that, we have increased man and woman power to enable tracing to be expedited as quickly as possible. So amazing work being done by our public health team. But it'd be wrong to make out it's fine, it'll all go away. We know that at some point we will have community seeding. We're not unique in this world to think we'll be able to escape the spread of the virus. The strategy isn't about keeping it out, but slowing the spread, protecting the vulnerable, and so flattening the curve of cases and minimising its impact. And we can minimise its impact by working together, listening and supporting the public health messages. Those messages will make the difference between life and death. And we all as a community need to support each other to abide by those messages. If we don't, based on all we've seen coming out of China, Italy and Spain in particular, our health service will be completely overrun and people will die unnecessarily. But at the same time, a lot of work has been done in the last week by Health and Social Care to increase our preparedness. Amongst those measures are the suspension of non-urgent outpatient appointments at the PEH campus and MSG from today. All those impacted will be advised, and if telephone appointments can be arranged, they will be. Unfortunately, despite requests to minimise contact with inpatients at the PEH, we've had to suspend all visits other than to those on Loveridge and Fossard wards and patients receiving end-of-life care. Those wishing to visit these patients should contact the ward manager in advance. The same arrangements will take place at the Mignon Memorial Hospital in Alderney. The number of entrances to the PH will be reduced in order that flow can be controlled, and there will be more information on that shortly. And finally, work was completed this week to convert the day patient unit into a hot ICU ward for those people with COVID-19 and be accessed directly from the emergency department. All these measures follow the HSC and MSG contingency plans, and more changes will be announced in the days ahead. Everyone in health and care, both HSC and its partners, are stepping up to the plate right now, and we need the community to work with us, to listen and abide by those public health messages, if we're able to manage this crisis in a controlled and manageable way. We can do this, but we can only do this together. Thank you.
Great, thanks Heidi. So, Nikki. That's a bit of an update from you.
Thank you very much. So, as I'm sure you're all aware, we're now up to 20 positive cases, as Deputy St Pier and Deputy Soulsby have said. We've had another 2 negative cases up overnight, so we're now up to 261 negative cases, and we've still got some results outstanding. However, most of the results outstanding now are from patients that were sampled over the weekend, so we really are getting on top of the testing situation, which is hugely encouraging. Now, as both Deputy St Pier and Deputy Soulsby said, is 18 new cases over the course of the weekend seems a lot, but it's absolutely what we were expecting. We were expecting to see more cases. On the 16th of March, we changed our areas of travel which we considered to be high risk. We did this because we looked at the data in those areas and we were concerned with both the number of cases in those areas but also the rate of increase of infections in those areas. So for that reason, we included those in areas that we wanted to screen symptomatic people if they'd travelled to those places. Really important because it enabled us to get hold of the positives. From our perspective, it goes back to our management of cases. So it's the detection of a case, it's the immediate quarantine, and it's that contact tracing. So when we got the results on Friday evening and Saturday morning, we didn't wait until Monday to start the whole process. We had an entire team come in. So we had 14 people working on Saturday and 10 people working on Sunday for about a 14-hour day. And we went through every single contact, every single case, identified their contacts, and very soon we will be able to see that we actually had 4 clusters. So these were people that had socialised together whilst away, and that was really reassuring as well. So the whole process of looking at the epidemiological data, defining areas at risk, and then saying, okay, those are geographically close to us, we're concerned about what's going on in those countries, then saying we want to screen people, symptomatic people coming back from those countries, rapid detection of cases within those cohorts of individuals, and then contact tracing and identifying of clusters. So it goes back to what we expected to see. So from our point of view, that was something that we went into our processes. We had a huge amount of help. The environmental health team came in to help. The Health Improvement Commission sent a member of staff to help. So these were all people that had been trained in contact tracing. So we said, right, we've got these cases, and called everyone in to help us. So it really rolled out as we'd expected to do. Over the rest of today, we'll be putting out some more guidance, and we'll be putting out guidance on what we call shielding. Now, some of you might have heard the concept of shielding, and that is guidance specifically for our vulnerable population, and we're advising them to self-isolate for a prolonged period of time to protect their own health and well-being. So that guidance will be coming out later today. So we're continually looking at what we can do to protect our communities, and not only with the identification of cases, the contact tracing, but also looking at what other policies we can do proactively. So it's balancing all of that together and trying to stay ahead of the curve. And I think from our point of view, that's the most important thing that we want to do for now.
Great, thanks, Nikki. And anything from you for over the weekend, Ruari?
Just to reassure the public that anyone coming into the bailiwick, whether that's into Guernsey or also into Alderney from any other jurisdiction, is being met by officers from the border agency, and the appropriate documentation is being given with those individuals to go into isolation. So that system is working very effectively on a daily basis. The only thing was there was some social media over the weekend of a particular incident outside a licensed premises. I think that was a classic example of irresponsible social media comment by certain individuals who posted as if they knew the facts in a case, and it was quite wrong. So I would just encourage the use of social media appropriately is really valuable. And as the Chief Minister says, it's about looking after each other and mental health and well-being. But please don't misuse it, and don't put information that is factually incorrect out there, because it just sends out totally the wrong message, and ultimately the people who post it will be proven to be wrong. So use it responsibly. As far as law enforcement and policing is concerned across the island, it is unaffected, and we are working 100% to support our colleagues in health, who we understand have a huge task, but anything that we can do to support them, we will continue to do so.
Great, thanks, Ruari. Okay, so we'll open it up to questions. Who wants to begin?
Were there any arrests or charges made over the weekend with respect to people not following the guidelines that were put out on Friday about pubs closing?
There is one investigation which is ongoing. I can't comment in respect to not adhering to the new guidelines, but other than that, the other matters we dealt with were for individuals rather than anything linked to a particular premises.
How would you say it went? How would you say the public response has been to this? Because it was very short notice. How did people respond?
I have to say the response of licensees and the hospitality industry was superb. They cooperated fully, other than, as I said, there is one investigation that we're looking at. There were also some minor issues around specific premises that moved into the Saturday, and when we discussed with particular licensees, they erred on the side of caution. They erred on the side of keeping the public safe and shutting their premises rather than allowing exposure to potential contact between individuals in confined spaces. We did some work on Saturday night with licensees who did remain open, and our licensing liaison staff were out talking to licensees, and clearly they didn't have many people in their establishments, but the ones that were open were adhering to social distancing and doing everything they could to keep their customers and clientele safe. So the response from the hospitality and licensing trade has been superb.
Good. And next question.
Yeah, I was saying the new ICUs that you're setting up, how many beds is that going to have? Are you able to say?
Well, it will depend on the number of cases we have. I mean, it's difficult to say right this moment, but we're just making sure that we've got the whole area prepared for it. So it will depend as and when we get the demand.
Are you actually modelling it in any way at all, trying to predict what might happen based on where we are at the moment?
Yeah, but Nikki can talk about that.
Yeah. So, yeah, we have been modelling it. It's using a number of scenarios. So you can use a reasonable worst case scenario, you can use the most likely model, but a lot of the modelling that you look at hasn't looked very closely at the mitigation. And what I've been really keen on from early on is to look at the mitigation and push that mitigation as hard as I can to flatten that curve. So a lot of the modelling looks at in the absence of any mitigations, and some of that looks really, really concerning. But if you then look at putting on how you can flatten that curve, so that's then a combination of your social distancing. That includes school closures, includes identification of cases, it includes contact tracing. So all of that together, what we're hoping to do is flatten the curve with that. And putting all of those factors together, you might be as effective as 60%, as reducing 60% of ongoing transmissions. And this is one of the reasons why we've been so keen that people listen and follow all the guidance we're giving on mitigation. This is serious. And the community needs to understand that this is serious, and it needs all of us to take responsibility, because all of our actions could cost other people lives. And I think that's really important that we take that on board and we try and flatten that curve as much as we can. We've gone for mitigation really early. We've had a very cautious approach. We think it's the right approach for the bailiwick. My concern has always been the fact that we have one hospital, and what you do see in other jurisdictions like in the UK in the course of a pandemic is all areas often don't get accepted at the same time, often don't get affected at the same time. So it's a random distribution, so you get various areas affected. But what you then do have is a second hospital that can help you sometimes. We know that's absolutely not the case for us, which is why we've gone so early and so strongly with mitigation. And I think from our perspective, what we've also been grateful is how fantastic people have been in supporting these processes early on, because we are doing a lot of the things in containment that other countries are doing in the delay phase. So we're moving quicker and faster, we're moving faster than a lot of other jurisdictions. But I think it's justified, bearing in mind our local situation.
And this is the really difficult part for the local population, because of course they're seeing all the jurisdictions around us in the next phase taking steps which they perhaps don't understand why we're not taking here. It's because, and it's understanding, having a big picture of what the strategy is and where we are in it is really important. And
making sure we're doing the right thing at the right time.
Yeah.
But we're absolutely prepared to accelerate if we feel we've got any indication to accelerate. So we've always gone early and very proactively with regard to the safety of islanders.
And we'll continue to do so. Next question.
With tracking people when they've come back and they have to be in self-isolation for 14 days, we've had several individual stories of people who have not been following that. And obviously there's a certain amount of public health pressure, social pressure for people to follow these rules, and that's what you're impressing today.
Yeah.
But what are you doing? Are you getting reports and are you following them up from a legal point of view to impress just how serious this is?
Yeah. So basically, we're first of all, one of the people that we were told was breaking self-isolation, absolutely reliable story. We happened to be talking on the landline to that person at the time, doing their safe and well check. So everyone who goes into mandatory self-isolation, who gets the letter on arrival into the bailiwick, we do a safe and well check on them every day. And if they don't answer their phone, we send the police round. And I sent poor old Ruari's officers round to 2 people this weekend, both of whom were at home, but their mobile phone had run out of charge or something like that. So the first thing I would say, it's important to get accurate data. But if people are breaking their self-isolation, this is a mandatory self-isolation. There is a letter that people get in when they come into the island that this is a requirement. And if they break that self-isolation, they're breaking the law. And what we'd do in the first place is check the facts and make sure it is the case. We had another picture of someone who posted a picture of herself and her mother on Mother's Day, and it was actually from the previous year. And everyone went mad saying she's broken her self-isolation. And she was actually missing her mother so much and was remembering the previous year. So I'm asking people to check their facts. Yeah. But if people are breaking self-isolation, they are putting the health of the island and the well-being of the island at risk. And that needs to be taken very seriously, because that is simply not acceptable for people to make individual decisions that puts the welfare of the greater good. And, you're talking about putting the welfare of vulnerable people, and we wouldn't hesitate to get help from the police under those circumstances.
Nikki, I just wondered if you could just speak for a moment, because I know it is causing some questions to arise around those in the household of the individual that's been self-isolated and what is expected of them, because again, I think that's one of the issues of anxiety for some. So
Yes.
perhaps you could explain how that household is expected to behave.
So what we'd do is we'd look at that household as a whole. So if it is two adults living in the household and they can separate out and have independent functioning, that's absolutely fine. But for example, if it's a child, we'd hardly expect a young child to self-isolate by themselves. So what we'd then say to the parents is, can one parent look after the child and the other parent carry on with their work? So we'll look at the individual circumstance. So every time we do a contact tracing and we put someone to self-isolation, they have an hour interview. So we speak to them. We then send them a pack on exactly what self-isolation is. So they get all of that together, and that gives them very specific advice. What we've tried to do is not just give people leaflets and say, there you go, goodbye. We've tried to look at individual circumstances. So people will say to me, well, I've got a 75-year-old mother that I'm worried about, and we'll say, well, this is what we recommend you do. But the basic principle is self-isolation is separating yourself off from the rest of the family. Now, say, for example, there's only one bathroom. We will say to them, okay, well, use the bathroom last and deep clean it after you use it. Don't use the kitchen at the same time, clean it after you use it. So there are ways in which we can keep people separate. So what we've been saying, if someone's in self-isolation, get the other member of your house to deliver your food, and then you can either put the tray outside and wipe it down, or else take it through the kitchen, put it straight in the dishwasher, turn the dishwasher on, wipe the surface, go back into self-isolation. So we give very specific advice as to what people should do, and very tailored to their individual circumstances.
Could you also just again speak for a moment about going outside the house? You know, whether it's into the garden or what's permissible, what isn't permissible.
So self-isolation is self-isolation, in that you don't go for a walk, you don't go for a drive, you stay in the house. If people have a courtyard outside their back door, which they want to go and get some fresh air, would absolutely encourage people to get some fresh air and so on. But that's not going for a walk on the cliffs. It's not going for a drive in the car, even by yourself. It is staying in your home. And that's really, really important. And I think as we move on, we're becoming increasingly aware about how hard self-isolation can be. So, for example, we're working with the Youth Commission to produce a set of resources for the under-25s going into self-isolation, of things that people can do. There's some yoga apps that are pretty good, and so there's all sorts of interesting initiatives that are coming out of this. So we're going to try and get together a sort of like pack of information that's again relevant locally for people to use with regard to that. But it is going to be tough.
And my final question, perhaps just following up, sorry, I know that the media is supposed to be asking the questions, but I think this is so important that it is important that we get some of these questions out, is in relation to if members of the public do have concerns about their next door neighbour who arrived back from London last night and is therefore in mandatory self-isolation. They believe that they're breaking that. What should they do about it? I'm very concerned that to see some almost, and I'm sure Ruari's keeping an eye on this, sort of vigilante-style Facebook groups starting to pop up. What is the responsible way for concerned citizens to address the question of somebody who they genuinely believe is breaking self-isolation? What do they do about it?
So I think there are two things they can do. First of all, they can let us know Public Health Services, and as I say, we have checked on at least 4 this weekend, all of which who actually were in self-isolation. So that's the first port of call. Alternatively, the police can also help you as well. So either or. We'd always try and take a public health approach in the first instance, work with the community, but if people are breaking their self-isolation, we won't hesitate, because they are risking everyone else in the community.
Great, thank you. Next question.
Deputy Soulsby, in the UK we've obviously been hearing about retired nurses and doctors being contacted to see if they would potentially come back and offer their services. Are there any plans for Guernsey to follow suit?
Yeah, absolutely. There's a lot of work going on behind the scenes, looking at how we can get more people back into the workforce during this period. We're actually getting people volunteering to come back without even needing to put out a call. That's why so many people, and particularly those in the caring professions, are seeing what's happening. That's by their nature want to come and help. So in many ways we haven't needed to, but we will be looking at seeing how we can help people come back and join the workforce, give training that is essential for what we need now. You know, it won't be like the full back to work training that we might ordinarily do in normal circumstances, but it be just those we can ensure people we've got those with that background and knowledge that could really help us now. So yeah, absolutely, and there'll be more information coming out on that in the next few days.
And just in the meantime, if we've got people who want to volunteer, who should they contact? What's the best thing? How do you wish to be? I'm looking at some of our senior officers.
So we've got quite a few email addresses and phone numbers around at the moment.
The wrong one, so
I think the best one at the moment is covid19inquiries.gov.gg.
Okay.
We're coordinating with some of the initiatives that the media are putting through around the Guernsey Press, the Island FM. So there's a team member who is looking about how we can work together to ensure that we've got the right volunteers into the right areas of the community.
So as this goes out, because I don't know if anybody can hear that from on the stream, it's COVID-19 inquiries at gov.gg.
Okay, great. Next question.
Are you, in terms of ventilators, are you satisfied that we have sufficient at the moment? And there's another thing. Has any discussion been had about perhaps making them locally? Because I know there are local firms that have said they have the technology and the equipment to actually, if we needed to, perhaps manufacture them.
Well, the fact is, if people don't follow public health messages, we could have all the ventilators that we could possibly manage to fit in the PH, and it wouldn't be enough. So I think that's the most important point here. We want to be able to use as minimal ventilators as we possibly can. We had 18 ventilators. There are ways we're looking at increasing that. We've got orders for more. But yes, we do understand that we might be able to source them locally. There is a project going on to see what we can do from that point of view.
Okay, if I can just add to help that, there is this specific team set up through our innovation and ideas, working to how we actually get additional equipment, equipment and ventilators into the island, and we're actually working very closely with friends in the private sector that are helping us actually acquire, and we've actually got some equipment en route as we speak. I believe it's only a number of days away to add to our resilience in regard to the equipment such as ventilators.
It's also important to realise you can't just have loads of ventilators. You need the people to be able to manage them and know how to use them. So at the same time, yes, that's why we need more volunteers, but also see if we can get more staff into that can man it and actually do it. It's you know, one thing. Nothing can be looked at in isolation here. It's quite a big task to make sure we've got all our ducks in a row, and so we're prepared, which is what a lot of people behind the scenes here are doing right at this moment in time.
With also being prepared, are you contacting off-island medical experts to try and come and work here during maybe a future date when we go beyond containment, as you have already been preparing for future dates? Is that something that's being talked about? Well,
yeah, we're looking at the future as well. I mean, we're trying to keep it as business as usual, so we're still trying to bring consultants over to do the day-to-day, looking after people who've got other conditions. We will try and bring in more resources as best we can over this period of time, but yes, there have been conversations off-island about bringing more people in.
Good. Any more?
You mentioned you're waiting on one piece of equipment to come from Australia. What exactly is that you're waiting on?
It's called a life cycler, I think is the phrase. Nikki can tell you all about what it does, and I'm sure it's fascinating, but that is really the last thing, and I understand it's plug and play, so once it's in and everybody's trained up, we can start that testing, and sooner rather than later, we're hoping.
It amplifies up the viral nucleic acid and allows you to then detect it. So it's using a molecular technology to detect the virus. The advantage is that we'll be able to do quite large numbers. Quite quickly, and we'll then start real-time managing our situation. So we want to try and manage it in less than a 24-hour delay of each event. So we'll really be able to start managing things very quickly. And it goes back to the World Health Organization, test. It'll give us a much better handle on things.
With a view to keeping us in contain,
Yeah.
if at all possible.
Or flattening the curve as much as we can.
Flattening the curve, isn't it?
But just as a follow-on to that, once the equipment arrives, how long is it going to take before it's up and running?
So what we'll have to do is do some staff training, and we'll have to validate the equipment, make sure that we're happy with its functionality. So it's difficult to say exactly how quick that will be, but we're thinking that what we've done to date, for example, is the staff have been doing Skype training. So normally what would happen is that you do face-to-face training. So there's been a lot of preparation with staff doing Skype training. So the other thing that we've looked at is all the extraction technology, because you get the virus as a whole, and to detect the virus as nucleic acid, you have to extract out the nucleic acids. So all those protocols have already been looked at. They've been sent back to Collindale to make sure that they're happy with the protocols. So all of that's been looked at. And so hopefully it won't be a huge delay, but it's difficult to say exactly. I don't want to put everyone under too much pressure. It's difficult to say exactly how quickly we'll get it in, but it will be reasonably quick.
Deputy Soulsby, you've spoken today about increasing staff resources where possible. Regarding law enforcement, Mr. Hardy, what capacity does law enforcement have at the current time if there were to be a community lockdown to enforce that?
Well, obviously we have a finite resource within the organisation. At the moment we are in a very good position. We haven't lost many staff due to illness. However, we do have to prepare for having staff off sick in going forward. We are already looking at what our priorities will be, so we can focus staff to ensure that we keep the population of Guernsey, Alderney and the other islands safe. So some of our normal business, I'm sure, will fall away, but we are quite confident that we have contingencies and plans to ensure that the safety of the island is maintained.
But I think it's a really important question. It comes back to, if you do need to lock down, when do you do it and for how long for? Because for that very reason, that actually if we were to simply, if you like, pander to the popular view that now is the right time to do it because everybody around us is doing it, we could find ourselves in 1 week, 2 week time with the entire population theoretically locked down, wondering why this has happened when there doesn't appear to be any development of this situation locally. And then at that point, if the community decide that they're no longer prepared to be locked down and come out at precisely the time that it would be dangerous to do so in terms of the progression of the disease. So this is why it's so important to make these decisions, as Heidi said, at the right time for our circumstances, based on all the evidence and the information that we have, rather than being influenced by what's going on around us. And one of the considerations is that very question of how long you can reasonably expect people to stay in given events. And clearly there will be if we're in the midst of the crisis, which is clearly going on elsewhere. We're not at that point, and therefore it would not be a sensible request of the population at this point. Is that fair?
Yeah, absolutely. And I think, if you lock down 2, 3, 4 months, it would be a prolonged period of time. And I think it's really important that we do the right thing at the right time. We're trying to provide as much evidence for each decision-making process. We're not going to get it all right, but we have erred on the side of caution.
And will continue to do so.
And will continue to do so, absolutely.
Next question.
A slight change of pace. I know with a press release that went out at 11, you also said that you're increasing the rate of pay for nurses. Can you explain the decision in that?
Yeah, I mean, clearly there's been an ongoing discussion of nurses' pay and for some time, and it hasn't reached a resolution. And our view is we just need to crack on and get that into the pay packets of that particular pay group. There are one or two other pay groups that we're also settling as well, implementing a pay settlement. And that, as much as anything else, was a decision by the Policy and Resources Committee as the employer over the weekend, really, as I said at the beginning, in terms of wanting to clear the decks of all these issues that are sort of been hanging around so that we can concentrate on the challenge at hand. The reality is, as we look at pay negotiations for the 2020 for other pay groups, and indeed heading into next year, we have no idea where we will be in terms of our economy, our public finances, and so the decision has to be, the only reasonable one on the behalf of taxpayers is we have to pause everything else in relation to other pay groups. But given that this issue, particularly for the Agenda for Change pay group, which of course includes nurses, had been outstanding for such a period of time, it seems unreasonable that they should be left hanging. Particularly, of course, they may have partners who are themselves experiencing financial stress if they are elsewhere in the economy. And recognising also that this is an incredibly important, the healthcare profession right now is an incredibly important profession at any stage, but clearly the community is going to be calling upon them to an extent that perhaps hasn't happened for many years. And the one less, if we can remove some further worries for them as individuals and their families, it seems a reasonable thing to do. So that really was the logic and basis of P&R's discussion. Any other questions?
I'll go again if that's okay. Yeah. I know you've said that other measures are coming for financial help for businesses. At the moment, we're getting a lot of individual examples of where particularly self-employed and small businesses are really struggling. Can you allude or give us an idea of what might be coming to help them, because they seem to be a little bit in a forgotten industry at the moment?
Well, I can assure them that they are not forgotten at all. Obviously, again, a lot have contacted either me or others directly. Deputy Lyndon Tross, as the Vice President of Policy and Resources, has been given the task of leading that work in relation to the economic crisis and also thinking about the recovery from that crisis as well. So that we need to be already thinking about that, even though we don't know how long it's going to be. So again, a lot of work has gone on over the last few days since I made that announcement in the Assembly last Wednesday, including over the weekend. A lot of engagement with both individual businesses and their representative groups, Chamber of Commerce in particular, and others. So there will be further. I can't give you the detail of when or indeed what's in it, other than give you the reassurance that it is a priority. It's a separate set of priorities to the public health ones, which are obviously those of very pressing concern, but we also do recognise that the economic crunch that is being felt by many individuals and businesses is now very real and needs to be addressed with as much speed.
Can I just build on the aspect from the health point of view? We've had contact from lots of different businesses saying they don't know what to do when it comes to social distancing and dealing with customers. So we can't answer for every single business out there. So what we have done is provide some guidance, which is on gov.gg, coronavirus, setting out just advice for different sorts of businesses about what they need to think about, how they make sure that there is social distancing, how they deal with customers and how they can rearrange their premises. And so it's, if people are concerned they don't know what to do, that's a place to go.
And again, it goes back to the point that I made first thing this morning, but also last week, that this sort of new normal state that we're in, that new normality does not require an entire economic shutdown. So businesses do need to take advice and look at the public health advice and make those judgments for themselves as to what's safe for their employees and their customers. But very much it's not a direction. The public health advice has not been a direction that every business needs to shut up shop. It's, again, it very much a case by case in terms of sector by sector has been the approach so far. Any other questions?
There have been 18 new positive cases since the previous press conference. Could you say in summary, Dr. Brink, what their condition is health-wise?
They're actually all doing really well, so thank you very much for asking. They're all doing very, very well, and none of them are inpatients. So we've been very encouraged by that. And if you look at the averages, we'd expect round about 10 to 15% to be inpatients. So the fact that we're not seeing numbers of patients with COVID-19 as inpatients is really encouraging as well, because it sense checks our figures in the community. Because if you calculate 15% being inpatients, and we've got 20 in the community with no inpatients, both of those figures align with each other. So all the time, every single bit of data we put out, we then go and say, does this make sense? And I think that's really important, that we say, well, here's our data. Does this ring true, or should we be concerned? And then when the team meets every morning, we look at our data, we look at the areas, we look at the information we've got, and we try and make sure that it's as accurate as it can be and that it all aligns.
And again, just really re-emphasise a point again that I was seeking to make earlier about this seeking to understand what the positive results mean, and that is it is very easy in human nature for all of us to default to focusing on the raw number, but understanding the background to that, and that of course is where the experts come in. None of us in this room, apart from Dr. Brink, are really in a position to interpret that, and so again, this is where the armchair and keyboard response to what is perceived as being a rapid increase in numbers is so terribly misplaced if you don't have the context, and that's why it's so important that we continue to be transparent and explain every movement that might cause concerns such as this one.
And regarding mental health, Deputy St Pier, something you mentioned this morning, obviously a lot of community services, particularly those that are going to serve the elderly and vulnerable, are going to have to cease temporarily, I'd imagine. How can the states support them to adapt, or services which aren't dependent on physical contact?
Yeah, again, there's a whole group of work, there's a whole set of work going on around that, thinking about how we can continue to support people in isolation, and again there will be different needs for different groups, and so yeah, and again huge offers of help coming forward from the community, both individual and groups, so that is being worked on. Again, I don't know if there's anything further we need to say on that at this stage, or when we expect there to be any further.
There's absolutely various initiatives, as you said, Deputy St Pier. The other thing is that we'll be starting this week sending out general wellbeing, health and mental health messages to the wider community through social media and other means as well.
Yeah.
So some general messaging about being taken care and what that means, as well as some specific initiatives.
I think also, just to add on to that, it's not all about the provision of the States. The States is working with the entire community. So we have a specific work stream group which is about our community. They've, for example, reached out and working with the Association of Charities and other bodies that are actually helping us to say, how do we all work together for best effect to support our community? So a whole tranche of work is going on in that particular area.
Yeah, in other words, just for on the stream, I don't know if people can pick it up online, it's about government facilitating those initiatives. Government can't do it all itself, and we've got people really working, doing 2 or 3 jobs at the moment, particularly in public health, to really do their thing. So it's about facilitating, making the community, again, it's all about the community coming together and supporting us.
And just also building on a point which Ruari made earlier about the impact and role of social media sometimes being negative, again, in terms of the impact on mental health. Really emphasising what we all know is that it can be a pretty toxic and damaging environment for people, and again another plea for people to be responsible and kind and compassionate in their use of social media, and not to vilify and seek to identify individuals and all of this dreadful behaviour that is the worst of social media. It can be, as we've said earlier, a very positive and useful tool, particularly for people in self-isolation. So please, as Ruari said, think before you press return and enter on your device.
Just turn it round to be a force for good.
Yeah. Any other final questions?
In your opening statement, you said it is probably an eventuality that we're going to have a coronavirus-related death. I wonder, does your approach change when that eventuality happens, or do you go as you are?
Well, again, I think Dr. Brink's probably the best person to speak to that, because to me it will depend very much on when it occurs and how it occurs and what the circumstances are. But Dr. Brink, you might want to just speak on that.
The mortality rate is about 2% overall, but obviously higher in certain age groups, so particularly the over 80s have got a higher mortality. We'd expect with our programme to have a good handle of what's going on in the community. So we will and have planned for coronavirus deaths. It is something that we need to face. It's likely that we will see one in our community. I think from our perspective, it's that whole approach. So we work with the doctors, nurses. There's actually a cell that is looking at supporting people through various processes, and I think that's really important. But would it change our overall approach? No. Our approach is a cautious approach, which we factored in both admission to the hospital, admission to critical care, and unfortunately death as well.
Okay.
It's changing for the evidence that in front of us. So that's when we change. When we see community seeding, that will might change how we deal with things. If we see behaviours in the community that are going against all the public health messages to try and limit the impact, then that's why we might make changes. It's always about what's going on, what the evidence is at any one moment in time that justifies the new decision making that we need to look at. That's going on constantly.
Good. Time for one final question, if anybody wants one. If not,
I've read heard a lot of stuff over the weekend about people claiming they have ways of either mitigating the effects of the virus or preventing it. Gargling salt water, drinking hot drinks, taking hot showers. It all sounds like nonsense to me. But I wonder if you could comment on that.
So we've looked at, we divide our approach to coronavirus into our pharmaceutical and our non-pharmaceutical interventions. So the non-pharmaceutical is what we've spoken about, which is the social distancing, quarantine, all of that. Then our pharmaceutical interventions. So there are some drugs that have been tried. There's a drug called remdesivir, which is a experimental drug. There's another drug that's been used to treat HIV, which is Kaletra, and we have some stocks of that on Ireland. Things like high-dose vitamin C has also been proposed as being beneficial in COVID-19. And in fact, when we're working up our treatment protocols, we are going to use high-dose vitamin C. It's unlikely to do any harm, or it won't do any harm, and if it might do some good, the early studies are looking potentially a positive effect. The other things like the gargles, I have seen so many different approaches, and we are teasing them all out into ones that we feel that really deserve a look at, and others that have no scientific base. And I'm probably going to sound boring, and you're all going to know what I'm saying, but we've got to go back to the evidence and look at what works and what. And sometimes when you're dealing with an unknown situation, you might say, well, this drug could hypothetically work, and you might use it this is a new virus, it's an evolving situation. So the drug called Kaletra hypothetically could work and was used with some success in China. No good studies on its overall benefit. It was just very anecdotal. It seemed to, this patient improved slightly. That sort of thing. So I think we've got to be very careful with all of the information.
Good. All right. Well, thank you very much, and look forward to seeing you again soon. Thank you.